Fenoprofen, also known as Nalfon, is a medication used to relieve pain from various conditions such as headache, dental pain, menstrual cramps, and muscle aches. It is also used to reduce pain, swelling, and joint stiffness from arthritis. Nalfon is a nonsteroidal anti-inflammatory drug, NSAID, which works by blocking the body's production of certain natural substances that cause inflammation. This helps to decrease swelling, pain, or fever. If you are treating a chronic condition such as arthritis, be sure to ask your doctor about non-drug treatments and/or using other medications to treat your pain. Before taking Nalfon, make sure to read the medication guide provided by your pharmacist. Take this medication by mouth as directed by your doctor, usually 3 or 4 times a day or as needed. It's best to take this medication with a full glass of water, and do not lie down for at least 10 minutes after taking it. If you experience stomach upset, you can take it with food, milk, or an antacid. The dosage of Nalfon is based on your medical condition and response to treatment. It's important to take it at the lowest effective dose for the shortest possible time to reduce the risk of stomach bleeding and other side effects. For ongoing conditions such as arthritis, keep taking this medication as directed. It may take up to 3 weeks of taking Nalfon regularly until you get the full benefit for certain conditions like arthritis. If you are taking Nalfon as needed, remember that it works best if used at the first signs of pain. Waiting until the pain has worsened may result in the medicine not working as well. Make sure to tell your doctor if your condition lasts or gets worse. It is important to note that Nalfon may cause upset stomach, constipation, nausea, drowsiness, dizziness, or blurred vision. If any of these effects persist or worsen, it is important to inform your doctor or pharmacist promptly. This medication has been prescribed to you because your doctor has determined that the benefits outweigh the risks of potential side effects. Many people using this medication do not experience serious side effects. Additionally, Nalfon may increase your blood pressure, so it is important to monitor your blood pressure regularly and inform your doctor if the results are high. Be sure to contact your doctor immediately if you experience any serious side effects, such as severe or persistent headaches, changes in hearing, mood changes, easy bruising, difficulty swallowing, rapid or pounding heartbeat, or symptoms of heart failure. In rare cases, Nalfon may cause serious liver disease. Seek medical help immediately if you experience symptoms such as persistent nausea or vomiting, loss of appetite, abdominal pain, yellowing of the eyes or skin, or dark urine. While it is rare, a serious allergic reaction to Nalfon can occur. Seek medical help right away if you experience symptoms such as fever, swollen lymph nodes, rash, itching or swelling, severe dizziness, or difficulty breathing. This is not an exhaustive list of potential side effects, so it is important to contact your doctor or pharmacist if you notice any other effects not listed above. If you are in the US, you can report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Nalfon, like other nonsteroidal anti-inflammatory drugs, may rarely increase the risk of heart attack or stroke. This risk may be greater in older adults or those with heart disease. It may also rarely cause serious bleeding from the stomach or intestines, especially in older adults. Be sure to talk to your doctor or pharmacist about the benefits and risks of taking Nalfon. And if you experience stomach pain, black stools, chest pain, or sudden vision changes, seek medical help right away. Before taking Nalfon, it's important to tell your doctor or pharmacist if you are allergic to it, aspirin, or other NSAIDs. This medication may contain inactive ingredients that could cause allergic reactions or other problems, so be sure to discuss any allergies with your pharmacist. Before using Nalfon, be sure to tell your doctor or pharmacist about your medical history, especially if you have asthma, bleeding/clotting problems, diabetes, heart disease, high blood pressure, liver disease, or stomach/intestine/esophagus problems. Kidney problems can sometimes occur with the use of Nalfon, especially if you are dehydrated, have heart failure or kidney disease, are an older adult, or take certain medications. Be sure to drink plenty of fluids as directed by your doctor to prevent dehydration and watch for any unusual changes in the amount or color of your urine. This medication may cause dizziness, drowsiness, or blurred vision. Avoid alcohol or marijuana, as they can worsen these effects. It's important not to drive, use machinery, or do anything that requires alertness or clear vision until you can do it safely. Nalfon may also cause stomach bleeding, especially with daily use of alcohol and tobacco. Limit alcohol and stop smoking, and ask your doctor or pharmacist about how much alcohol you may safely drink. Be cautious in the sun, as Nalfon may make you more sensitive to sunlight. Limit your time in the sun, avoid tanning booths and sun lamps, and make sure to use sunscreen and wear protective clothing when outdoors. If you are an older adult, you may be at greater risk for stomach/intestinal bleeding, kidney problems, heart attack, and stroke while using this drug. Women of childbearing age should talk with their doctor about the benefits and risks before using this medication. It is not recommended for use in pregnancy from 20 weeks until delivery, and if your doctor decides that you need to use this medication between 20 and 30 weeks of pregnancy, you should use the lowest effective dose for the shortest possible time. This medication also passes into breast milk, so be sure to consult your doctor before breastfeeding. When taking Nalfon, it's important to be aware of potential interactions with other medications. This includes products such as aliskiren, ACE inhibitors, angiotensin II receptor blockers, corticosteroids, lithium, methotrexate, and certain water pills. These interactions can affect how Nalfon works and may increase the risk of serious side effects, so it's essential to keep a list of all the medications you use and share it with your doctor and pharmacist. Additionally, Nalfon may also increase the risk of bleeding when taken with other drugs that can also cause bleeding, such as antiplatelet drugs and blood thinners. It's important to be cautious and check all prescription and non-prescription medicine labels carefully, as many medications contain pain relievers and fever reducers that can interact with Nalfon. Furthermore, Nalfon may interfere with certain lab tests, potentially causing false results. It's crucial to inform lab personnel and all your doctors that you are taking Nalfon so they can account for any potential interference. It's important to follow your doctor's instructions and not start, stop, or change the dosage of any medicines without their approval. If you suspect an overdose and the person is experiencing severe symptoms like passing out or having trouble breathing, it's important to call for emergency help right away. In the U.S., you can contact the local poison control center at 1-800-222-1222. In Canada, reach out to a provincial poison control center. Symptoms of overdose may include severe stomach pain, slow or shallow breathing, extreme drowsiness, and loss of consciousness. Always seek medical assistance if you suspect an overdose. Another important thing to note is that you should not share this medication with others. It's also essential to keep up with any lab or medical tests that your doctor recommends while using Nalfon, such as a complete blood count, liver and kidney function tests, and blood pressure checks. Making lifestyle changes, like weight loss if needed and strengthening or conditioning exercises, can also help improve flexibility and joint function. Be sure to consult your doctor for specific instructions on how to best incorporate these changes into your routine. If you are taking Nalfon on a regular schedule and you miss a dose, take it as soon as you remember. If it is near the time of your next dose, then skip the missed dose and take your next dose at the regular time. Do not take a double dose to make up for the missed one. It is important to take Nalfon exactly as prescribed by your doctor to get the most benefit from it. When taking Nalfon, it's important to store it at room temperature in a tightly closed container, away from light and moisture. Be sure to keep it out of reach of children and pets, and do not store it in the bathroom. When it comes to disposing of Nalfon, do not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard the product when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to dispose of it. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.